Hello, good afternoon. I'm Andrew Capehart with the Adult Protective Services Technical Assistance Resource Center. Welcome to today's presentation, Improving the Quality and Completeness of Your NAMRS Submission with the APS TARC team, and I will introduce all of them shortly. Next slide. Before we get started, a quick disclaimer. This webinar was created by the APS TARC, administered by WRMA Incorporated under the contract number you see on your screen from the U.S. Department of Health and Human Services, Administration for Community Living, Administration on Aging. The views expressed in this publication do not necessarily reflect the views of the policies of the Administration for Community Living or the U.S. Department of Health and Human Services. Also, the models and information provided during the webinar do not serve as official guidance to comply with any part of the APS final rule. All information provided is done so for informational purposes only. I think I get faster every time I read that. Next slide. So again, this webinar is being hosted by the APS TARC. We work with states to enhance the effectiveness of APS programs by supporting federal, state, and local partners' use of data and analytics, applying research and evaluation to practice, encouraging the use of innovative practices and strategies, and providing APS programs with individualized technical assistance. Basically, this all means we're here to help you in any way that we possibly can. If you're a state APS program, just reach out to us at any time. We'll have some contact information displayed at the end of the webinar, and you'll also have a liaison that you can reach out to as well. Next slide. So here are the team members that you'll hear from today. Each of us will give a little bit of information on NAMRS moving forward and how to improve your submission. It is a pretty good looking team, if I do say so myself, and each of us will give a little spiel for you. So next slide. A little bit of housekeeping. If you're having issues with your audio or require live captioning assistance for this webinar, please go to More, the three dots on the menu at the top of your Teams window to make adjustments. Select Audio Settings to make adjustments to your speakers or speaker volume. Select Language and Speech, and then select Live Captions for captioning assistance if you need that. Everyone's muted for this webinar. You may ask questions of our speakers at any time by selecting the Q&A tab at the top of your Teams window and typing the questions that you have to ask there. We'll answer as many of these questions as we possibly can when we pause at the end of the presentation. For any questions that we can't answer, we will email you afterwards and follow up with an answer for you. Next slide. This webinar is being recorded, and everyone who registered will receive an email when the recording has been posted to the internet on the APS TARC YouTube channel and website. The slides for this presentation have been posted to the web, or will be posted to the web at the same time that the webinar recording is posted. Again, you'll get an email about that, and then all attendees will also receive an email after this webinar ends with a link to an evaluation, very brief evaluation survey. We would greatly appreciate it if you could take that for us. It helps us to know how we're doing and to get feedback from you. So thank you for that. Next slide. Here's some of the highlights of what you're going to hear today. We want to give you a status update on how we'll move forward with NAMRS for federal fiscal year 2026. Talk about improving data completeness and quality, discuss an analysis of data gaps, review priority data elements, talk about minimizing the use of quote unquote other wherever possible, and touch on moving toward case component submission for those that have not done so already. I'll give you a few tips on that. Next slide. I'm going to take the first part and just give you a little bit of information about where we're going with NAMRS for the coming federal fiscal year. Next slide. The plan is for NAMRS to be operational early in federal fiscal year 2026, which starts in October, with minimal changes to data elements. We do need to comply with recent presidential executive orders, so we'll be removing sexual orientation from NAMRS and changing the term gender identity to sex and removing the transgender data value. Since there was no data collected this federal fiscal year, we won't be releasing a traditional NAMRS report because we don't have data to run a report on. Instead, you'll see a 5-year trend report release coming in the next few months, and it does include state-specific data for the first time, so we're excited about that. We want folks to be aware that some states and territories will have a new liaison. Not very many, just a few of you may have a new NAMRS liaison moving forward this year. Here at the TARC, we're moving to a system where you will have one single liaison for both NAMRS and programmatic technical assistance. You'll have the same person for both. And so subsequently, a few states will see a little bit of a shift. Next slide. For the 2024 and 2025 submissions, we want to make states aware that they'll need to resubmit their mapping and their data, unfortunately. With the minimal changes we're making, this will still be necessary on the tech end. We want to provide as much flexibility as possible for the timing of the two submissions, 2024 and 2025. We'll be asking states to submit both this coming federal fiscal year, and they will need to be done sequentially due to the validation checks between the years. So you'll have to do 2024 first and then do 2025. We'll give you as much time as we can for both of those. Beyond these points, we welcome all of the feedback that you'd like to provide us to make this transition as soon as possible. You can drop comments in the chat if you'd like to tell us what your thoughts are, or you can email us. You can email your liaison, or you can use the email at the end of this presentation to give just general comments. We'll make sure that we see those. Next slide. So at this point, I'm going to turn things over to my colleague, Carl Urban, to take things from here and talk about improving data completeness and quality. Carl.
Good afternoon. So I want to give y'all a little bit of background on the work that we have done up to now to provide data completeness and quality. Basically, I'll be sort of setting the framework for some of the more specific discussion that is going to follow. So next slide, please. Wanted to start off with just a brief discussion about why NAMRS data quality matters. And the basic idea is to tell you how we have used the data in the past. So the data has been used by ACL, it's been used by us, and hopefully it's going to be increasingly used by you as we go forward. The first column there talks about some ways ACL has used the data. When they were working on the final rule, we would get lots of questions about how many programs are doing X, Y, or Z, and that helped inform some of the decisions that went into making the final rule. And then it's, as all data sources like this are used, it's used to answer questions from the public or from public officials about adult maltreatment in general. So it's a great data resource for that. We have used the data in a lot of the evaluation and research work that we have done. If you're familiar with the process evaluation that we did, you saw extensive use of the data in it. You've seen extensive use of the data in some of the technical assistance briefs that we have written. And then, just like it's a resource to answer questions from the public, it's a resource to answer questions from APS programs. And so we'll get questions from APS programs that NAMRS is a really good resource to help us answer. Next slide, please. But like I said, we increasingly want to encourage you to use the data yourself through whatever benchmarking process that you may have. And so, as Andy mentioned, the report that's coming out this year is going to contain state-specific data. In the past, we have not shared state-specific data, but it is now a resource for you to use to improve your program effectiveness. Please don't hesitate to reach out to us if you have questions that NAMRS data can help answer. Next slide, please. So I want to transition to talking about some of the work that we have done in the past to try to improve data completeness. And again, this is going to be sort of setting up my colleagues for talking about some of the more specific things. And so beginning in 2020, we really have had a focus on improving data quality, and there's been 3 steps that we want to talk about that we have done. The first was an assessment that we did looking at the data. The second was to, after doing the assessment, to talk to the states about what we think it means and what we can do to improve things. And then we have sort of incorporated it into our ongoing efforts to work with states as liaisons. So let's talk about each of these very quickly. Next slide, please. We did a data gap, data quality assessment for ACL back in 2020. And this is literally the slide, and as the next couple of slides, these are literally the slides that we used back in 2020 to communicate the results of our assessment. So we did this assessment to try to understand what were the weaknesses in NAMRS data and start the process of thinking about strategies for improving the quality of it. We wanted to understand how the data can and cannot be used. Where were there problems with data completeness where we didn't really feel like we should be using the data, for example? once having thought that through, we said, okay, well, where are the areas that we can work with states to try to improve the data? What are our realistic targets for improvement? And then, we are continually going through a process of thinking about what data elements should be included in NAMRS, and that helps inform us to think about what data should or should not be included in NAMRS. Next slide. So when we completed that analysis, this is what we determined here. We looked at data quality really in two ways, and this is setting Brian up to talk a little bit about some of the stuff he's going to talk about. We looked at it by state, and we looked at it by data element. So what percentage of data elements does each state submit? And then what percentage of states submit each data element, if that makes sense. And so when thinking about those two things, the first thing we looked at was, okay, how many states are providing case component data? That we want to improve. Increasing the number of states that are providing case component improves the overall data quality. And what we discovered, and you'll see some data on this later, is that states over time had increased. The number of states that were providing case component had increased. So then the next question is, okay, well, what about data completeness? Where are their strengths and where are their weaknesses in the data? And what we found was that victim data and perpetrator relationship data was the weakest data that we were receiving. Demographic data, particularly on clients, was by far the most complete data. I can show you cute little charts on that if you are interested in that. From an overall big picture perspective, we discovered that states' data submissions really vary greatly in terms of completeness. And the interesting thing that we found was that the states that provided more data elements had more unknown or missing data. So if a state was aggressive in mapping more data elements, what they ended up with is more missing or unknown data. And when you think about that for a second, I think that's pretty intuitive and kind of what you would expect. So at a very high level, that's what we found. What did we think we ought to do about that? What we came to understand was that we needed to understand better. And so we started the process of talking to the states about why these gaps and why these things existed the way they did. And so we started this discussion process. And the other thing that we recognized is that we needed to get to a place where we were sharing state-specific data so that states could compare themselves to each other and have some incentive to improve through working together and having the opportunity to use the data. So next slide. So that was step one. And so step two was to have this discussion that I just mentioned about data gaps with states. And so when we went through our liaison process starting in 2021, we had a very focused conversation with states about data completeness. And we've kind of continued those conversations subsequent to 2021. Some of you will be familiar with the data completeness charts that we provide you each year now. That came out of this whole analysis that we started back in 2021. The first thing we do is to give states some feedback. Your case component mapping is poor, fair, or good. And we have encouraged states every year since then to do a better job of mapping, thinking about why they are mapping certain data elements or not mapping certain data elements, and have that discussion about what should or should not be included. And then we discussed 3 questions to try to get the issue of data completeness. Why are states providing or not providing the highest potential level of data, be it KI or CC? What are the reasons that data elements or code values are not mapped or included? And what causes missing or unknown data? And we're going to delve into each of these in the rest of this webinar as we go. So next slide, please. So then the next question was, so then that follow-up, one of those questions is, why do states not provide a higher level of data? So if you're an agency, why are you not at least providing KI data? If you're a KI state, why are you not providing case component state? And so for the agencies so for the programs that were providing only agency data, basically it came down to they didn't have a case management system that was responsive enough, or they didn't have the support from their IT department, or some combination of the two to get them to the next level. The more difficult question then was, why are states providing only KI and not case component? And it was somewhat the same answer in that they may not have had the IT staff assigned with the time and the resources to be able to dedicate to producing the case component level of data. And we also discovered in this that one of the problems that agencies were having was that worker turnover, particularly in IT departments, would really kind of set them back. Then there was a more broad macro problem, particularly in the county-based states, or in states that were reporting data from multiple sources. That ability to combine the data from the different sources into case level data was difficult and was a prohibition, going from just the pure performance measure data of KI to the more case-specific data of case component. Next slide, please. Then remember, the second question we discussed was, well, why aren't you providing certain data elements? Why are you not mapping to them? And some of the answers were, we can't do it. State policy, for whatever reason, limits our ability to either collect the information or to be able to provide it for confidentiality reasons. A second reason was that, our data, the way we collect the data, our code values just don't align. We can't map them in a way that aligns, therefore we're not going to be able to provide that particular data element. I think the one I think about first with that is the services one. We have a specific set of code values on services. You may have a specific set of values on code services, and you can't make them align. Therefore, you're not going to be able to provide it. Next reason, information is only collected in narrative fields. We can't translate narrative fields into your discrete fields, and therefore we can't provide that particular information. And then the last one, which is the more difficult one, is that data elements are not a state, NAMRS data elements are not a state priority, and we require policy changes and expensive system changes. We fully recognize that changing an IT system takes time and it takes money, and we don't have the time nor the money to be able to make those changes at the present time. Next slide, please. So then the last question is, why is there missing or unknown data? And really, this is the hardest nut to crack, right? How do I get my caseworkers to provide more information? And you see a laundry list of reasons here. This is really not even an exhaustive list, and I think these are all things as APS professionals we are going to be familiar with. Some clients are hard to find. Some things are just not considered important in the worker's mind. Some data is sensitive and that they really want to ask about it. Sometimes the system design gets in the way. And sometimes states are only requiring things if a case is substantiated, and you could probably come up with 3 or 4 more reasons from a caseworker perspective that there's missing or unknown data in a particular case. So that's the overview of the things that we have done to try to improve data. We've done the analysis. We think we understand some of the causes, and we've tried to address some of them in the liaison work that we have done since then, and in some of the things that we are about to talk about now. And so Brian is going to kind of give you a picture of where the data gaps are.
Thanks, Carl. So I'm going to take a moment to talk about what we look for when analyzing gaps in the NAMRS data, and just kind of take a look at the state of the data as they are today for the most recent year, which we have, which is FFY 2023. Next slide, please. But before we start looking at some of that data, I do want to briefly talk about how we analyze gaps in the NAMRS data and what we look for. And this is a lot of what Carl had said previously. So Because NAMRS is still, relatively young as a data collection, when we talk about gaps in NAMRS data, we're really looking mostly at data completeness. So looking at stuff like how many states are submitting, how many states are able to provide case component data versus those that submit key indicators data. And of those states that submit case component data, how many are able to submit each data element? We also look at the proportion of data that are submitted with a known value as opposed to those submitted with either an unknown value or no response at all, which we can break down by state and data element or even by case. We're going to look a little bit, though, at data quality today as well as later in the presentation, particularly data elements that have an other response option. So how often is that option being selected in comparison to other, maybe more concrete response options? Next slide. So I'm going to start off by taking a look at the NAMRS submissions by states each year and which data components were completed. Do note, though, that the data here are indicative of the data submissions at the time that the data were pulled for the NAMRS annual data report, which is authored by the APS TARC each year. So if a state submitted data at a later point for a prior year, that's not going to be included here. You can see that we have added significantly to the number of states that are able to provide case component data since NAMRS inception in 2016, going from 24 states at that time all the way up to 36 in the most recent year, 2023. But we have kind of stagnated over the past 3 years. You see there's 36 states going back to 2021. There are additional states that have started providing case component data during the past couple of years, but we have also had a few states unable to provide submissions those years as well. Next slide. If we look at the data from 2023, again, which is the most recent year we have for NAMRS submissions, you can see that the majority of clients' investigations and victims that are submitted to NAMRS are coming from case component submissions. But there still is a significant amount of data that's coming from key indicator states. Just under 40% of each of those populations are coming from key indicators. Key indicators data are more limited than case component, which we'll talk about more later in the presentation. So ideally, we're always looking to encourage states to submit case component data whenever they're able to. Next slide. Looking overall at the case component data, specifically, that was submitted to NAMRS for 2023, we can take a look at some of the optional data elements and how each case measures up with those data elements. So for 2023, on average, a client would have 12 of the 29 optional data elements submitted for them with a known response. An average investigation had 4 of the 5 optional data elements submitted for them. For perpetrators, and we have filtered out for victims of self-neglect that are also reported as the perpetrator here, only 2 of the 6 optional data elements on average were reported for them. And for victim-perpetrator relationship, on average, you have 3 of the 7 optional data elements. So this kind of goes in line with what Carlos has said, in that the perpetrator and the relationship data are the most difficult to submit. Next slide, please. So we're going to review some more 2023 NAMRS data here, starting with the investigation data elements. I haven't included case closure data here or case closure date here, since that is a required data element. To explain the graph that you're going to see on this slide and the upcoming ones, there's 2 bars for each data element. The first yellow bar is the percentage of case component states that submitted that data element. So if you look at report date all the way over at the far right, the yellow bar's at 100%, meaning all 36 of those case component states submitted data on report date. The second dark blue bar is the average percentage of cases that had a known value. In other words, not missing, not unknown, among those states that submitted the data element. So again, an example, if you look at report source, which is all the way at the left, so of those states that submitted report source, on average, just over 90% of their investigations had a known report source that was submitted to NAMRS. All of that to say here, looking at investigation, we actually have really high completeness and participation among these data elements. Next slide. This next one is the client data elements. Don't worry about trying to digest all the information on the slide here. As Andy stated at the top of the presentation, the slides are going to be shared later, so you'll have access to pour over those numbers then if you wish. What I really want to demonstrate with this exhibit is how wide the variability can be in both participation and completeness with some of these data elements. You have those that have really high participation and completeness over on the right, like age and sex and case closure reason. But there are others that are not being submitted by many states, and the data that are submitted are on average not very complete, such as over on the left, we have schooling level, interagency coordination, behavioral health conditions. These can be a lot more difficult to collect and map and report to NAMRS. We're going to take some time later in the presentation to discuss some priority data elements among these to consider focusing on for future data submissions. Next slide, please. And then we're not going to look at the maltreatment data since both of those are required data elements, but I do want to take a brief moment to look at the perpetrator and the victim-perpetrator relationship data elements. So the data here, again, are filtered so that victims of self-neglect that are reported as the perpetrator are not included. As expected, in going along again with what Carl mentioned earlier in their presentation, you can see that the data completeness is much lesser in comparison to the client and investigation data elements. You do still have some that are relatively more complete, like kinship, perpetrator sex, and the victim-perpetrator cohabitation data elements. Most states are able to provide the former two, and then roughly half of states being able to provide the latter. Next slide, please. And then one last area I want to highlight that we're going to cover a bit more later in the presentation is the use of other as a response option. So as an example, let's say maltreatment disposition. Instead of reporting a maltreatment as substantiated, unsubstantiated, or inconclusive, the disposition would be reported as other simply. So all of the data elements that you see here have a response option of other. And each bar represents the percentage of known data where the response was listed as other. So looking over on the right, you can see the highest percentage is for client behavioral health conditions, where nearly 40% of clients where we have a known value reported for behavioral health conditions, that value is being reported as other. Client benefits, perpetrator behavioral health conditions, and victim perpetrator association at start and close, again, they all have percentages around 30% or above. But the majority of the data elements, though, are around that 5 to 10% mark that you can see here. And again, we're going to talk more about this later in the presentation. Next slide. But now I'm going to turn it over to Michelle to talk more about our next topic.
Okay, well, thank you, Brian. So as Brian said, in this section, we're going to walk through some of the NAMRS data elements that are being prioritized for submission in the upcoming years. The goal of this section really is to show you not just what we're prioritizing for collection, but really why it matters for APS practice and outcomes. Next slide, please. So ACL has asked that our team help you to prioritize the following elements. I'm going to go over each in detail, everything that you see on the screen here, and then focus on why each of them is important. Next slide, please. So as you see on this one, reports accepted for investigation. This element tracks the number of reports that APS accepts for investigation during that reporting period. Well, why is that important? It tells us about workload and demand, and it also lets us compare across states to see how criteria for accepting cases might differ. It can also support standardization, which then means when we put the data side by side, we're confident we're comparing the same thing. And that makes the data far more meaningful for national reporting and policy development. Next slide, please. This one is reports not accepted or resolved through INR, INRA. This one really tracks the number of reports that APS does not accept for investigation during that reporting period. And why is this one important? It tells us again about workload and demand, our role in APS as resource connectors, and it also lets us compare across states to see how criteria for accepting cases might differ. Next slide, please. Okay, this one's pretty straightforward, assessment tools. Do staff across your state use standardized tool? Consistent use of common tools improves data quality, makes results more reliable, and helps identify best practices. It also supports sharing strategies linked to stronger outcomes and allows ACL to compare service effectiveness across programs that use different approaches. Next slide, please. Okay, this one's pretty simple. This tracks who made the report, so report source, a doctor, law enforcement, or family member. Knowing where your reports are coming from helps us in APS to focus on outreach and education efforts. For example, if certain sectors rarely report, training or outreach or education may be needed in that area. And it also gives us insight into how often mandatory reporters are filing. Next slide, please. Okay, this one's on maltreatment settings. So again, where the abuse is happening, whether it's in the home, in a facility, or some other setting. Having this information helps APS target prevention strategies and work with licensing bodies or partner agencies to reduce some of the risks. Next slide, please. Benefits. This element tracks the benefits a client is already receiving. So SSI, Medicaid, SNAP. Knowing this helps us advocate better and connect people to resources they may be missing. It also tells us if safety nets are in place or if there are any gaps that we need to be addressing. Next slide, please. Okay, disabilities. This element looks at physical, emotional, or mental health issues that limit a client's ability to fully participate in daily life. Capturing this information is important because functional or physical limitations may increase risk and affect how services are delivered. It also helps us as APS tailor our interventions to each individual's unique needs. Beyond APS, this information encourages collaboration with healthcare providers, disability services, and community organizations to ensure support is comprehensive. Finally, it strengthens outreach to external partners who can address needs that extend beyond APS's scope, creating a broader safety net for those people that we're serving. Next slide, please. Okay, so behavioral health screenings or diagnosis. And I know Brian talked about this. It was kind of on the low end of one of the scales that he showed you. So this captures results from behavioral health assessments. It's important because it informs our case planning. It strengthens coordination with behavioral health systems and can also highlight training needs for our staff. It's both a service planning tool and a systems building tool. Next slide, please. Okay, substitute decision makers at start or close. So this one tracks whether the client has a decision maker, like a power of attorney or a guardian, at the start or close of the case. Monitoring this helps APS evaluate if interventions affect decision-making arrangements and whether rights are preserved without unnecessary guardianships. Next slide, please. And this is our last one. This one captures referrals APS makes to other agencies. It's about measuring our collaboration and spotting gaps in partnerships. Strong interagency connections are what allow APS to address complex client needs that no one system can solve alone. We all know that, right? So to wrap up my section before I turn it over to Leslie, these priority data elements don't just improve reporting. They help us to understand our workload, the client needs, service gaps, and collaboration opportunities. Ultimately, the goal is that better data leads to better services, and that means better outcomes for the adults we're serving. Okay, so now I'm going to turn it over to Leslie to discuss eliminating the use of other.
Okay, thank you, Michelle. Well, we've talked about gaps in the data because it's not submitted and gaps in the data because it's missing or unknown. And now I want to talk a little bit about the data that is both submitted and known and still leaves a gap because the information is submitted using the code of other. Next slide, please. I stole Brian's slide from a little earlier and tweaked it a little bit so that we can revisit the percentage of known data from NAMRS that is submitted as other. There are 28 NAMRS data elements that have other as a code value, either as a standalone code value or as part of another code value, such as other professional, which is found under the report source data element. States submit known data using some form of other for 25 of the 28 elements where it is an option. That's almost half of the case component at data elements. And this results in us having known data that doesn't necessarily tell us a whole lot. The bars that I've highlighted in gold on this graph all have other as a standalone code value. And these 5 elements, interagency coordination, maltreatment setting, client disabilities, benefits, and client behavioral health screenings or diagnoses, are also included on the list of elements that Michelle just went over, meaning we will be focusing on them with respect to increasing data completeness and quality as we go into our next submission period. Next slide, please. There are a few reasons why data is mapped to other, and the first reason is that it is the most appropriate code value, right? There are going to be instances where that is the best fit for the data the state is submitting. However, Carl already spoke about the other 2 reasons listed on this slide when he talked about gaps. When data is submitted using other, whether that is because the state's code value definitions do not align with the NAMRS definitions, or it's because the state collects different code values in their system than what NAMRS collects, the result is the same. We cannot identify or quantify what is being submitted when it is submitted as other. Next slide, please. So for example, this is the list of code values for behavioral health screenings and diagnoses, which is the data element that has almost 40% of its known data submitted under a code value of other. When a state maps data to code value number 6, we at least know that the client has been screened for some type of psychotic disorder. We do not know if it's schizophrenia or some other psychotic disorder, but we do have some information about the behavioral health issue, right? When data is mapped to number 9, however, we don't have any idea of what the behavioral health issue is for the client. So here are the definitions for the standalone code value of other for those priority data elements that we've been discussing. And they were taken from the NAMRS Code Values and Definitions Specifications document, which is a resource that is available for you on the NAMRS website. I'm sure you can see the theme. It's a catch-all category in case the state is reporting something not included or not matching the list of defined code values. We get that. Next slide, please. Then we get to the behavioral health screenings and diagnoses data element. And not only do we have the catch-all of conditions not included in the list, but we also have a whole list of examples of other things that other could be. And so we have no idea from our side what we're looking at. Next slide, please. So why does this matter? That's kind of another sub-theme of our presentation today. Both Carl and Michelle touched on this in their discussions. NAMRS data is collected, reviewed, and compiled to help identify how we can better and more effectively support your programs and further develop the APS system as a whole. The data helps us all have a better understanding of the clients being served by our programs and supports ACL in providing a coordinated response within and across states for helping victims and doing the all-important work of prevention, right? The data also helps us understand what's going on in the field and can be used to help create a framework of standards for how programs operate. And last but certainly not least, as Carl mentioned earlier, data is critical in supporting program research. To do these things, we need the type of detailed data that is provided through the submission of case component files, and we also need that data to be submitted using specific code values to give us more information than other does. Next slide, please. So that takes us full circle back to mapping. For the upcoming submissions, during our kickoff meetings, our TA discussions, and our submission reviews, there will be an increased focus on improving data mapping. We are asking state teams, when you do your pre-submission review, to remember that copy forward is just the beginning. Mapping doesn't change much from one year to the next. That's understandable since policies and systems don't really change frequently. However, adding drop-down options or simple changes that don't usually require policy or system updates, so it can be easy to forget that drop-down lists changed and then not update the mapping document to reflect those changes. Some of these mapping documents were created years ago, and we need to revisit the mapping because we need to review whether the state system codes currently being mapped to other might align better with a more specific NAMRS code value. We also want to make sure states are utilizing the comment fields in the mapping document. Some states use them to track where data is being pulled from. Some states use them to list the state system code values that they map to the NAMRS code values. And then there's quite a few states that don't use them at all. We want to strongly encourage the use of the comment fields, especially for the use of other, to provide some idea of what that data means. When we do our data completeness reviews, we are looking at how much of your data is known, as well as the percentage of your known data that is other. The mapping document provides that context for us. It helps us better understand what you collect and what you submit, and the comment fields are absolutely invaluable when we see larger percentages of known data in the other fields. Going back to that list of priorities for NAMRS data on the previous slide, it's very simple. We cannot move forward using NAMRS data if we don't have quality NAMRS data. And with that, I'm going to turn it over to my colleague, Jennifer. Next slide, please.
Thanks, Leslie. I'm going to talk about some next steps that you might be working towards if you're looking at case component submissions. So many states report agency components and key indicators, but what is it about case components that is holding some states back? You might have some questions. How do you do it? Who can help? And we'll get into that in my presentation. Case component collects information about the alleged victim, the alleged perpetrator, the type of abuse, neglect, and exploitation, the resolution of the case, like was it substantiated or not, and what types of services were provided to alleviate the abuse, neglect, or abuse, neglect, or exploitation. Next slide. So looking at the idea of case component, we really need to think about what is the ultimate goal or the gold standard. And when you're submitting data to NAMRS, the gold standard is case component. Over half of the 56 states, as Brian suggested in his presentation, report case component. And reporting case component data is compiled in one database across all states, namely NAMRS, and all states submit that in a common format. And if you are submitting case component, you're doing that in an XML format. The data is de-identified because many states have confidentiality laws that prohibit them in reporting case-specific information. Next slide. So why is it important to report case component? I think that when we think about improving our APS programs and reporting as much data as possible, we look at case component because it really identifies the trends that we're seeing nationally. It helps us understand victim and perpetrator characteristics and assess the effectiveness of APS programs. More data is better data. And to dive a little bit deeper, reporting case component data creates an environment where all states would be reporting the maximum amount of data to NAMRS, which enables us at the APS TARC to have a comprehensive understanding of APS programs nationally, as well as ACL. Next slide. So keeping with that theme of why it's important, case component data allows for much more robust analysis. We can do more with more data. So for example, we can look at durations and reoccurrence. We can look at demographic information and operational information and really see what the big picture is in a more detailed manner. And like Andy said at the beginning of the presentation, the 2023 adult maltreatment report will have case-specific information included. And you might ask, why does data tell the story? And I'm going to give you a couple of reasons. And like Carl said at the beginning of the presentation, there's many more reasons, but here are a few. It really makes the data more understandable. Data can be complex and overwhelming, but when it's woven into a narrative format, it becomes more accessible and easier to grasp. It enhances engagement. Storytelling taps into the emotional and intuitive parts of our brains, and that makes the data more memorable and impactful. Data drives action by providing context and highlighting key insights. Data storytelling can lead to better decision-making and encouraging stakeholders to take action based on the presented information. It might also reveal hidden patterns that you're not aware of. It can reveal patterns and relationships that don't appear to be apparent in raw data alone, and it might lead to new discoveries and insights into that data. And lastly, it fosters collaboration. Data storytelling can bridge the gap between technical and non-technical audiences, and that enables better communication and teamwork across disciplines. Next slide. So for about half of you that aren't reporting case component data, there might be a lift that's associated. And like Carl said, according to the 2020 data completeness analysis, states reported the following reasons why they're not reporting CC. It doesn't mean that this is an all-encompassing list, but these are kind of the top 6 things. So staff turnover impacts quality. As you can see, these roadblocks involve staff, specifically staff not able to enter data and reporting it out to NAMRS. So how do you reinforce data collection with staff? To effectively reinforce data collection with staff, focus on clarity, training, and ongoing support. Clearly define objectives and protocols, providing training and data collection methods and tools, offer consistent feedback and support to ensure accuracy and consistency. Additionally, offer a culture of open communication and data-driven decision-making to reinforce the value of data collection. Next up, develop a plan to secure the IT resources that you might need. If your leadership understands the APS importance of federally funded APS or federally APS funded programs such as the APS TARC, which does the adult maltreatment report, or the newly developed and implemented APS final rule, they might be more willing to prioritize APS IT needs. As administrators, you need to see value added for increasing the documentation requirements for staff, allocating limited resources to system design, and be able to defend what your program needs system-wide. Next slide. So I'm going to take you back to operational planning for just a minute. You might recognize some of these steps in operational planning for change management and working in your program versus working on your program. Working in your program is doing all the day-to-day urgent things that you need to do for your program. Working on your program requires you to take a step back and look at the big picture of how your program runs and making system-wide improvements. It's easy and natural to spend all of your time in your program, but as leaders, you really need to occasionally work on your program. So is this change to case component new? Yes. Was it scary doing operational planning? Maybe. Did we tackle that task together with the APS TARC and NAMRS staff with operational planning? Yes, and we can do it together again for NAMRS data. And here are some reminders from one of the webinars that you can take back to your staff. Next slide. As I said in the previous slide, we can do this together. And if the time is now for your APS program to get started on case component data submissions, we can help at the APS TARC. As Zig Ziglar said, you don't have to be great to start, but you have to start to be great. So what are your goals for your program? And how can we help you work on your program? Zig Ziglar was known as a highly influential motivational speaker, particularly recognized for his work in training, personal development, and leadership. You may recognize his name from previous operational planning webinars. He emphasized the importance of positive thinking, goal setting, hard work, and inspiring millions to pursue personal and professional success. Next slide. If you are a program that has not been able to submit CC yet, ACL and the APS TARC will provide as much technical assistance as needed to support your state to move to case component. You can contact your APS TARC liaison to set up a plan or to help develop a plan to report CC in the coming years. Technical assistance for NAMRS is provided by the APS TARC, and the APS TARC is funded by the Administration for Community Living, or ACL. And we offer various supports to state adult protective services programs, including training, guidance, and one-to-one assistance, which would be the case component submissions for about half of you that are listening today. And now I'm going to hand that back over to Andy.
Thank you very much, Jennifer. We have a few minutes left for questions. If there are any, you can use the Q&A function to ask your questions. You can put them in chat too if you want to. So we'll let people think about that or marinate a little bit on what we said to see if there's any questions. There was one question that I will repeat that came in through chat a few minutes ago, and it was from Victoria Golick Morse. Has there been a deep dive into the data points that make up those quote unquote other submissions? Again, has there been a deep dive into the data points that make up those other submissions? I will give my cursory answer and let my team either correct me or elaborate. I believe that would take a qualitative look at the comments for the mapping field to find out what is being made up from other. I'm not sure if we've done that before, but I do think it's a good suggestion, which I said in chat. Leslie, Carl, Brian, anyone have anything to elaborate on with that?
I don't think we've done a deep dive. I think we've done cursory, and the process for changing data elements is such that we would want to only undertake it after some careful thinking about it and getting the timing right for doing it. But it is a very good suggestion.
It's a very good suggestion. Again, it does take kind of a qualitative analysis of things to look at the comments. Not all states give us comments for other or tell us what they're including in other, but some states do. I know several of my states do. So there is something worth looking at there, I think. Did anybody else want to elaborate on that briefly? We have another question. Go ahead, Leslie.
No, I said no. Go ahead.
Okay, good deal. Another question. Did I hear at the beginning of the presentation that the states that completed their fiscal year 2024 submission will need to resubmit? Again, did I hear at the beginning of the presentation that states that completed their 24 submission need to resubmit? Yes, you did. I'm sorry to say. The mapping will change. The XML schema will change a little bit because of the fact that we have to remove the data elements of sexual orientation. We have to remove the data value of transgender and change gender identity to sex. That will change the mapping, and you will need to resubmit. Can you use the data that you submitted last year? I'm not sure, but we'll get into problem solving with you on that when we start taking submissions. So
yeah, the operative thing there is a little bit, you'll just have to make minor changes to your mapping and minor changes to your programming. So it shouldn't really be much of a burden, but you do have to in fact do it.
Andy, there is one question also in the Q&A. In addition to asking if it was still offline, there's a question of when access will be granted again.
So earlier we said we plan to do this early in federal fiscal year 2026, which starts in October. I don't have a date for you right now, unfortunately, but again, we do plan to do it as early as possible, flip the switch on as soon as we can. You know, I fingers crossed in the first quarter, if not in the early first quarter of federal fiscal year 2026. And we'll communicate that with you as soon as we know what the date is and get in touch with you via liaison and or through a blast email to everyone.
Andy, do you see Daniel's question?
I do. Yeah, and I think everybody can read that, so I won't repeat it. Go ahead, Carl.
And the answer to it is just continue notating what options are on the state side and do not fit into the NAMRS do not fit into the NAMRS mapping.
It's worth a conversation with your liaison, I think, every time you're looking at what you're going to put under other. It's easy to get into the rut of, well, we always put that under other every year, when it might be a good time to reevaluate that and see if it belongs under a different data element. When you look at the definition of what the data element is from NAMRS, it might actually fit. So it's always good to revisit that.
And the other, maybe it's too self-evident thing, is to encourage you to consider additional data elements that map and don't have to be stuck into other as well. So
I'm looking at the chat and the Q&A. I'm not seeing other questions. We'll give it another minute or so to see if anyone has questions. If you think of questions after we're done, or you have questions you want to ask privately, you do have your state liaison that you can work with and talk to directly and ask those questions. You don't have to do it here. It's not a speak now, forever hold your peace situation. Well, not seeing anything in Q&A and not seeing anything else in chat. We'll give it just a few more seconds to see if anything pops up, and then give you maybe 2 minutes of your time back if nothing does.
Do you have one more slide, Andy?
Oh, yeah, good. Thank you, Leslie, while we're waiting on that. Justin, if we could go to the next slide. This is how you can contact us. You have our web address. You've got our email address. You have a QR code on the slide, but we'll also email you with a link to the webinar evaluation. We would greatly appreciate it if you could take that for us, just a handful of questions, and then you get all of our socials. We'd love it if you could follow us in any of those accounts. And then I'll take one last look at the Q&A. I'm not seeing anything chat. So I think that we are done for the day. Thanks for joining us so much. We're glad you could come and hear about what our priorities are for the coming year. And the liaisons here are ready to help you in any way they possibly can. We look forward to working with you in the coming year. Thanks, everybody. Have a great rest of your day.
Bye.